Well, welcome everyone. I'm Donald Wicks, founder and CEO of ClearPath AI and host of the Clinic Efficiency Podcast. I'm really excited today for our conversation with Jon Higginbotham. He's the founder of Select Health AI. And Jon, your journey from clinician and a decade as a sales rep for home care, home base to founding Select Health AI is a powerful testament to your understanding of the healthcare landscape. It's clear you're driven by a deep commitment to solving real-world problems and revenue cycle management. If you would, please introduce yourself and tell us a little bit about your background.
Yeah, hey, thanks for having me on. Yeah, so Jon Higginbotham, I am a registered nurse, graduated from Baylor in 2008 and started in pediatric nursing at Dallas Children's in 2009. And I was kind of early on really interested in the software part of healthcare. So like the EMRs, we were migrating from Cerner to Epic at the time, Dallas Children's was. I always thought it was really unique how the documentation is always a burden, but how you can make it more efficient. And Epic had some stuff that was pretty cool where it would, you could press like dot T and the time would go in. You could press dot, D and the date would go in, dot vitals and the vitals would flow over. So I always thought it was unique how software could really transform documentation. And so then I did travel nursing, did all of that stuff. And then I actually got hired on during one of my travel assignments to migrate Oakland Children's Hospital from Meditech to Epic. And so I was both a clinician, but also help support for the clinicians that needed help in Epic as it was a significant change for them. And then a couple years later, I ended up at Home Care Home Base. I implemented Home Care Home Base to a lot of the customers at Home Care Home Base before I joined the sales team and sold EMRs for 7 years as the head business development guy. I ended up as the VP of business development at the end of my tenure there. And it was kind of an easy transition to go and create your own platform for some of the gaps, right, that I saw during my time at Home Care Home Base. So, yeah.
Yeah, that's good. Well, Jon, your origin story for Select Health AI stemming from the pre-claim coding inefficiency that limited your RCM company, Select RCM Services is incredibly insightful. When you did that vision for automating and scaling RCM really start to take hold for you, I mean, what was the aha moment that led you to build Select Health AI?
Yeah, I mean, we had worked with coding partners at Home Care Home Base for years, right? And the question that I always brought up on our partner calls was like, is there anything to automate the coding, right? Because first of all, the bearer of the burden of clinical inefficiency is always the clinician and the administrative staff at the provider, right? And so for me, it was more about impacting the clinical efficiency and lowering the price. And so when I started Select RCM Services, it was with the identity that we were, the next part of it was going to be creating an AI tool to automate some of the workflows that really burden coders. Coding in home health is a significant burden. There are a lot of things that you have to do, both on the coding side and on the Oasis side. And then when you're looking at plan of cares, like there is just so much that impact quality, star ratings, that then impact value-based purchasing, that impact reimbursement. And the rules are out there, right? And Medicare updates them every quarter to, and then there's usually a big update every year. But I just knew that there was a way to create for me, it's always going to be a hybrid program. I don't think autonomous AI in coding is ever going to happen because there are so many nuances with different EMRs and the way that clinicians document. So for me, it's always going to end up being like there is an AI tool that is assisting the coders to make them exponentially more efficient. But that's kind of how I went from transitioning, the revenue cycle services business and coding business into, tech enabled, if that makes sense.
Right. Well, that makes sense. That leads right into the next question I had. But on the Select Health AI website, you state your goal is to use AI to drive efficiency, quality, and accuracy to lower costs for providers. Given your background, how does AI specifically address the significant technology gap you've identified in home health and hospice, particularly in the pre-claim coding and revenue cycle?
Yeah, great question. So, home health and hospice historically has been about 10 years behind acute care when it comes to technology. The EMR platforms, EHR platforms are, really, I would say limited in their scale. The largest EMR platform is still Citrix based. So like there's it's really hard to, and the biggest struggle honestly is interoperability in the space. Um, Now it is such a like niche of healthcare, right? The percentage of Medicare dollars being spent on home health and hospice is only 2%, right, of the total spend. Um, Even though home health and hospice provide better outcomes in at home than any other realm of healthcare, right? So it makes sense to really kind of dive in on that. But the clinical efficiency there is, and sorry, I lost my train of thought, but we were talking. Give me some more feedback. Ask the question again.
Yeah. Yeah, no, it was given your background, how does the AI specifically address the significant technology gap you've identified in home health, hospice, and particularly with the pre-claim coding
Yeah.
and revenue cycle? Yeah.
Yeah, so the big problem with it is interoperability, right? So interoperability
Hmm.
is such a gap, because there are certain requirements that CMS has required with certain acts of sharing information, right? But the big problem is that information sharing, is it usable data, right? So it's easy to just like export a PDF, right? But what you really need is, you really need to break down that PDF where it's usable and searchable and can really be um, chunked into data. So then I can pull out those sections that I need. So as I was building, and my team was building Select Health AI, the foundation of it was, how can I first get the PDF, referral information into usable data, right? Once I can get it into usable data, then I have the ability to go in and run my AI model on that usable data. So that was the first thing. So we're using OCR and screen scraping and all of that stuff to pull that data over. And then the second piece of it is creating a model to really look at the data and figure out, okay, what belongs in which section. How can I improve, their comorbidity adjustments. So like in home health coding specifically, there are adjustments, right? The more diagnosis that you have, the more reimbursement that you're going to get, because that patient is sicker, right? And it
Right.
makes a lot of sense. So if I'm able to use AI to, instead of a human having to read every page of referral, sometimes these referrals come in, they're 180 pages. So if I can like have AI to automatically scrape for keywords and diagnosis names and that sort of stuff, it really makes the job of a coder a lot easier. They can really focus on, is the documentation there to prove that that is the right code? Is this the right, diagnosis code as the primary diagnosis for why they're on home health services? And then do we have justifying information and a plan of care that really like goes along with those diagnosis codes? So like if they have a primary diagnosis of CHF, do we have interventions and goals supporting that? Because what we've seen now with pre-claim review, that has kind of hit most of the states in the US, like they will, they will reject your claim. So, or what they call non-affirm. They'll non-affirm your claim, and you won't even get to submit until you fix all of the stuff that needs to be fixed. So, um, and a lot of that is the primary diagnosis doesn't support the need for home care, a skill. There's no skill, documented. There's a lot of stuff that for reasons, but AI does a really good job of picking and pulling once you're able to use that data. So that's kind of, yeah, I hope that answers.
Yeah, that's good.
Yeah.
Well, I know many healthcare providers are struggling with increasing regulatory burdens. How does Select Health AI leverage technology to help clinics regain efficiency and counter these growing compliance challenges rather than adding to it?
Yeah. The big key here is like I said, every 3 months, Medicare will come out with new coding guidelines or addended
Right.
coding guidelines, right? There's a big release in January of every year, and then there's a big, uh, quarterly. They'll get some addended rules in that, and so it's really important to be up to date on the coding guidelines because there are certain codes that are not billable. There are certain codes that will increase or decrease your adjustments, and so you really need to have insight into those rules, or you're going to be losing out on money that you should be getting to take better and more care of the patients that you're providing care for. So it unless you have somebody, even professional coders, reading through and understanding the new guidelines every single time, it's such a burden. And a lot of home health organizations, they're community home healths, right? They don't have capacity
Hmm.
to do that, and especially with margins decreasing because of CMS cuts, there's just you just don't have, you can't find someone with the capacity to do that, because a lot of times in home health you're wearing multiple hats, right? You're not just wearing the hat of coder, you're wearing the quality assurance manager or clinical manager or director. So that's where things really help organizations kind of streamline the new updates to the regulatory burden. And some of these
Sure.
updates were massive, right? The patient-driven groupings model that happened in um, 2019, they really, really significantly changed the model of reimbursement for home health. So it's been a learning curve for a lot of organizations. I think people have hit their stride now, but there's still, these codes change all the time, and um,
Sure.
now we're just anticipating when is the new ICD-11 sort of coding grouping going to come out, because that's going to come soon enough. We've been on ICD-10 for 10 years now, and ICD-11s will be coming out soon. So what does that mean? How does that work? And what is the mapping back and forth? So yeah.
Sure. Yeah. As a former 10-year sales rep for home care or home base, you understand the sales process intimately. I mean, you've mentioned that selling is easier than you have, or when you have tangible value to offer, even at a higher price point. So, can you share an example of a customer story where Select Health AI delivered such clear, tangible value that justified the investment for a client?
Yeah, so I have a customer based out of Dallas, and they're a pretty decent sized or medium sized agency, which I consider anything like 1,500 patients or more. And what they have seen specifically is around the comorbidity impact. So the way that we're able to scrape the referral for as much as we can to get a comorbidity adjustment. And it's not just the comorbidity adjustment. In the comorbidity adjustment, there is high and low, right? And so what we have seen specifically with them is they are seeing an increase in the high comorbidity adjustment and a decrease in zero comorbidity adjustment. So that is where, so low and high are increasing, no comorbidity adjustment is decreasing substantially. So that's really how we've been able to leverage, and that is a substantial impact financially to these organizations. We're talking almost seven figures. Um, good six-figure reimbursement adjustments just because we're able to leverage technology to identify diagnoses that should be on the plan of care and should be on the the always the information set that's submitted to Medicare. um, that humans have, it just takes time, right? How long does it take to read 180 pages of a referral? It's really unsustainable for humans to do. So
Yeah, absolutely. Looking at the broader picture, how are you thinking about the future impact of AI in healthcare? I mean, what are the next frontiers for AI in improving clinician efficiency and overall patient outcomes that Select Health AI is exploring?
yeah, I mean, the next like iteration is partnerships with other entities. So um, there are some organizations that are really good using AI when it comes to clinician documentation, right?
Hmm.
But
Right.
the gap is the QA part, the post documentation, aggregation of data, and quality assurance scrubbing, right? And so, like my next step in this is partnering with some organizations that have the clinical documentation, good to go with AI, and then partnering with them so then the back end, the administrative burden of documentation is also empowered with AI. So then not only is the documentation going to be faster, but it's going to be more thorough and should impact their reimbursement. So I look at it as kind of a double impact to their margins, right? Because their clinicians that they're paying the same amount are able to do more visits, and they're also on the back end, getting a higher reimbursement because the quality assurance is better on the back end. So it really is kind of double dipping and improving margins.
Yeah, absolutely. Well, John, on thinking about your go to market and how are you actually going after new business and new customers? What's your strategies?
Yeah, I mean, since I'm kind of new and kind of small, like a lot of it is word of mouth, right? And I am not selling the my AI tool separately yet. I am using it internally for my coding company or my coding and revenue cycle company. I'm using it internally so that we gain more efficiency, right?
Right.
When you start selling software, there's a lot of things that you have to get to ensure, HIPAA, PHI protection, and you typically need like SOC Type 1 and Type 2 certifications. Like, there's a lot of things that you really need to have before you get to the point where you bring a SaaS, software to market. And
Sure.
so while we are seeking those certifications right now, I won't go to market until I have those certifications. So, because I mean, if we're being transparent, a large entity is not going to purchase software that doesn't have uh, those
Right.
certifications. So, until I get those certifications, I can't go to. I wouldn't, and I shouldn't go to market anyways. But like I said, we're in the middle of seeking those certifications. So,
Sure. That's very good.
yep.
Well, finally, for clinic leaders listening today, what's one actionable piece of advice you'd offer them regarding leveraging technology to improve their RCM processes and achieve greater efficiencies?
Yeah, and I wouldn't even limit this to just like coding, right? Which is kind of my big efficiency gain. I would really leverage technology to drive efficiency all around. There are specific revenue cycle, AI enhancements that are available. So like reconciliation of payments to like what's in the bank, right? That's an easy one that AI can be extremely accurate in and really kind of do a lot of the hard accounting work that has to happen on the back end. So like those are useful tools. I really think that in every part of your operations, you really want to have efficiency gains through technology. And a lot of that is happening with AI. So whether it is on the initial intake, right? You have, partners out there that can go in and scrub a referral and input that information with API connections to the EMR. So it's automating sort of that intake part. For the clinical part, there's some AI tools out there right now that are using oration mixed with human intervention to like really streamline and speed up the documentation as well as improve the thoroughness of it. On the backside, right, the tools like us that are going to automatically look at the documentation and validate the right code so you can maximize revenue. And the end goal being like, and I just want to make sure this is very clear, the end goal is Medicare is going to pay you what they pay you, so how can I provide the best care to a patient for the cheapest cost, right?
Right.
and
Right.
and it's also has to do with, right, there's a big gap in nurses finding a nurse to do home health visits, right? So if I don't need as many nurses doing home health, right, organizations are going to have way more capacity to, on choosing who they hire, how they hire the clinicians, and not just nurses, therapists as well, PTs, OTs, STs, and
Sure.
aides, right? All of the sort of foundational group of home health, it's going to really help. And then the back end, obviously, collecting that money. There are AI tools that automatically send out notifications to for copays, or send out notifications to pay via credit card, send out notifications to pay. There's a lot of stuff out there that on the back end side, the administrative side, that are really helpful. I've also seen stuff like predictive modeling, right? There's AI tools and machine learning available that are going to predict hospitalization. They're going to predict, if the patient is at risk for certain things, or and then there are also tools out there that can automate patient communication, right? So, okay, I see
Hmm.
your mom had a fall. Do you want us to send somebody out there, right? It can be an automatic text to
Sure.
their caregiver. So there's a lot of ways to, AI that's available right now that can really enhance the clinical and patient experience.
Yeah. No, that's very good. Well, thank you so much for your insights today, John. I think this was incredibly valuable, and I really appreciate your time and openness.
Yeah, thanks, Donald. I appreciate the invite on the podcast.